You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. This episode's guest is Kim Boyd, an industry consultant specializing in healthcare policy, strategic planning, interoperability, and standards. She is also a co-editor and contributor to the POCP Interoperability Outlook subscription solution. On this first episode of 2022, Ms. Boyd speaks with today's host, Pooja Babra, and co-host Jocelyn Keegan about the regulatory landscape from expected new rules and legislation to developments in compliance and enforcement. We hope you find today's episode informative and helpful. If you have topic ideas you'd like us to cover in future episodes, be sure to share them with us by emailing us at podcast@pocp.com or tweeting at POCPHIT.
Hello, everyone, and welcome to our first episode of 2022 for The Dish on Health IT, where we invite health IT leaders and trailblazers to break down and discuss some of health IT's biggest news and most exciting milestones. We at Point of Care Partners are health IT consultants who work with stakeholders across the healthcare ecosystem and are viewed as an independent, trusted party like Switzerland. So I'm Pooja Babra, Senior Consultant and Payer and PBM Lead here at Point of Care Partners. And you may notice that our regular podcast host, Ken Kleinberg, is not here for this episode, but he'll definitely be back. In the meantime, I'm your host for this episode, and I'm thrilled to be moderating this discussion with two other wonderful women in health IT. So my colleague and co-host, Jocelyn Keegan, and I are excited to welcome our special guest, Kim Boyd, a consultant specializing in strategic planning, healthcare policy, interoperability, HIT, and standards. Now, for full transparency, she has recently joined us as a co-editor and contributor to the Point of Care Partners Interoperability Outlook subscription service. Now, because this is the first episode of 2022, what we wanted to do today is take a look at the regulatory landscape of interoperability. So we're going to be discussing what new regulations we might expect in the coming year, as well as compliance and enforcement of existing rules. Now, before we jump into the discussion, I want to have Jocelyn briefly introduce herself and what excites her about today's podcast. Jocelyn?
Great. Thanks, Pooja. Really excited to be here. Super excited to have Kim at the table with us. I've actually had a chance to work with Kim in a couple different places over the last, probably 6 years or so now. Kim's actually my partner in crime over at the NCPDP EPA task group, where we really have had, I think fledgling signs and maturing signs of, trying to crack this nut that's interoperability for a number of years now, and have really tremendous admiration, knowing that much of the legislation and regulatory action that we're seeing has Kim's fingerprints on it from her longstanding work at CoverMyMed. So I'm glad to have you here. Excited to hear sort of the pragmatic approach that you bring to actually getting real enacted policy in place, and focusing on, what you really need to do for real to get people to actually solve problems and not necessarily just pass legislation or put regs in place. So excited to be here and excited to hear you guys kick off the conversation.
Great. Yeah. Thanks, Jocelyn.
I'm sorry, Pooja. Yeah, thank you. Thanks, Jocelyn. Thanks, Pooja. I appreciate it. Pooja, were you going to say something?
Yeah, I was just going to say, Kim, do you want to introduce yourself and tell us a little bit about how you got into policy and regulation in the health IT space?
Yeah, absolutely. Thank you so much. It's good to see you both. Thank you for having me today for sure. It's definitely a pleasure to see you both. I can't wait to see you in person, hopefully sometime in the near future, at least in 2022, I hope. My goodness. So, Pooja, great question. I do have a law background as I was a paralegal in the United States Air Force. However, I do wish I could say that from an early age, I knew that I wanted to bring about change in our world through policy and regulation. Quite honestly, I was given this great opportunity by chance encounter. I had a chance encounter with two very incredible business minds and owners that were forming or had formed a startup in healthcare delivery and management of patient care and patient coordination. They mentored me. and taught me the business from the ground up. And in 2001, oh my gosh, 2001, that was that long ago, California, imagine California proposing a regulation. California, proposed a regulation that was, could have been quite detrimental to our business and several of our competitors in the business. So they knew I knew the business, and they asked me to go up to Sacramento and talk to the regulatory bodies and to the legislators there about why that was not going to be a good thing for patients nor for business. So I got hooked. I testified there, and I never looked back. So I've been hooked ever since.
That's great. I love it. And we often forget like how important the, regulation and legislation is in our industry. So Kim, let's kick off the discussion and just kind of starting at a high level. We, of course, the past couple of years have been very busy with new rules coming out. What do you see coming out this year from ONC and CMS?
Yeah, I think many are of the mindset that ONC and CMS will continue to build on the endeavors that we saw in 2019 and 2020 to advance not only interoperability, but data fluidity, transparency, and things that a lot of folks are already talking about and have been talking about and trying to work toward compliance since those rules passed. But there's still so much work to be done. And I think the public health epidemic has only, really highlighted the fact that there really needs to be full interoperability in our healthcare system, merging what, is the administrative and the clinical and, even the financial side of information that flows through our ecosystem and get to that fully collaborative and coordinated care on behalf of patients using that data fluidity to effectuate that change. It will definitely be interesting to see and be engaged in what ONC is planning through their health interoperability outcomes 2030 endeavors. I'm definitely excited for the future of healthcare interoperability, and hopefully, finally, we'll eventually get rid of those faxes once and for all.
Yes, that's definitely a great goal. And it was fun to watch all the replies to the 2030 endeavor. So that will be great to watch. So what about legislative activity? I think most of us would assume, just in this current political climate, that there isn't going to be a lot kind of happening, right? It's tough to pass laws, but do you see any with any areas that have really enough bipartisan support where we may actually see some new laws passed around these topics?
Yeah, great question, Pooja. We do have so much to accomplish in our country, and our representatives are faced with significant challenges, quite honestly. But I do think that there are some areas that we could see synergies and bipartisan support. And one of those areas is definitely in health equity. For sure. Congress and the administration are setting the stage for reimbursement models focused on social determinants of health, and more specifically around funding and standards development focused on SDOH, or social determinants of health. At present, I think I last counted when I checked, I think yesterday or Friday, there are like 99 pieces of legislation that are focused on equity in various phases of the congressional process, which are right there sitting in Congress to take action on.
That's great. Great insights. So Joss, I want to turn to you. What are your thoughts? Are there certain rules you hope get published? Kind of what's on your wish list for this upcoming year?
Yeah, it's really interesting because to Kim's point, there's so much activity going on right now. And I think one of the things, and we know is near and dear to my heart, is our progress around prior authorization. And just even in sort of the closeout for 2021, we saw activity happening both at ONC around certifying people around prior authorization. We've seen activity with, the CMS team signaling via the unified agenda that they're picking back up the rules that were put aside during the administration change last year. So I'm hopeful that we'll have traction there, and that we'll see in that policy set, really, I'd say the levers that we need in place. If we think about the work that's happening in industry to really sort of unlock technology to help us solve these business problems. If we think about the rules or potential rules as being alignment to get the industry to say, this is the path we're heading on, and keep that alignment moving forward and putting some timetable about it. I think that's what we would love to be able to see from a point of care partners perspective, and sort of, to Kim's point, active folks in the industry that really want to see us, get real solutions out in the market. There's a certain amount of momentum and sort of certainty that many of the players, right, that are looking to implement some of these early standards that are happening around Da Vinci and the other things that are happening in the FHIR fire space that that we really need that certainty that comes along with intent being put into place and the desired direction being put in place by policy.
Yeah, definitely. Kim, I'd like to get your take on that. I know just with your background from, Cover My Meds, as well as leading the task group and kind of looking in the future, just curious kind of your thoughts around prior authorization and automating or electronic PA.
Yeah, I think Jocelyn's right on point with that. I think we've seen an evolution in our healthcare ecosystem, especially on the medications front. As you mentioned, I was with Cover My Meds. I was with them for 6 years, and they've come a long way in moving away from, faxes and things of that nature, going to an fully electronic means. But there's still work to be done. Smaller payers are still not on board with, electronic prior authorization to date, but they are moving that needle. And to Jocelyn's point, I think with CMS and ONC coming out talking about the usage and the benefits of that usage to further, reduce burden for providers and get patients access to their care on a more timely basis. I think certification and additional rulemaking coming out of ONC and CMS will be forthcoming. I think we saw on the recently on the unified agenda, for example, to expect another, EPA rule coming out of the agency sometime in February. And I think it's rightfully so that we need to continue to dig and move forward with the evolution in electronic prior authorization. Just as the standards bodies are evolving the standards and continue to create, effective means and standards evolution to address it, I think the regulators are definitely watching that and are ready to pull the lever on, requiring certification, for example, relative to prior authorization, which I think will help move the needle.
Yeah, definitely. That's some great food for thought, Kim. So Joss, you and I talk a lot about kind of adoption, right? And getting the providers to use it. And I just want you to kind of comment on, in lieu of rules or legislation requiring providers to use these tools, whether it be EPA or real-time benefit check or anything else, the creators of these tools can, how can they increase the usage, through either user-centric design, kind of establishing just a strong value model, or any other approaches? Can you comment a little bit about that?
Yeah, and I think Kim intoned this at the very beginning of the conversation. I think looking holistically across all of these workflows is really important for us, right? Because we have made progress on the pharmacy side of the house, and with the momentum that we're seeing real-time benefit have, and when we look at the approach that we're taking over on the medical side with Da Vinci, what we're able to see is not just the act of getting a prior authorization done. It really is about the transparency aspect, right? Am I going to get better information in this workflow? Am I going to be able to solve a problem that I can't solve today? Is this going to be better, or at least as good as what I'm doing today in my hook or crook sort of manual automation that I've created? So, all of those things that you talked about, I think, Kim's point, we are at a point in time, both through regulation and the move towards value-based care and the tools that are available to be able to create that patient-specific information, that is only going to get more and more complex as plan designs evolve and continue to get more and more complex over the coming years, to being able to arm providers, the provider team, and the patient with the right information about what does their insurance cover, what is available to them for options, so that they can have that same sort of consumer experience and design in, selection, as part of designing their care path and their plan with their provider that we as consumers have really in every other walk of our life at this point in time, and I think that, pulling on the thread that you started with, Kim, that, we're going to continue to see, more and more input and more control from a patient perspective of what they're doing. So, there's a reality though, right? Which is, at the end of the day, when you roll out new solutions and you have new capabilities, you acquire butts in seats one at a time, right? Like there's just a reality. And so we need to think about how we do this in an incremental way. We need to make sure that the policy and the regulation that's being applied is being done in a thoughtful way that's not going to create additional burden for providers and to be mindful of current workflow. So I think that we really need to take that approach of learning as we go, feeding back into the payer and the provider side of the house to say what's working and what isn't working, so that vendors can build solutions that are going to make it easier for providers to get this work done. Because we know we can build all the things in the world. If they're not usable and they don't actually solve the problem, or they don't make the problem easier for providers won't pick up and use them. They won't change their current habits, which is why in 2022 we still have a world that's filled with fax machines, because they solve the immediate problem. So I'm hopeful that the tools are available. I think the key as we go into this year will be making sure that the people that are designing solutions are mindful of the fact that it needs to be in a user's workflow, it needs to be usable, and that it needs to be better than what the current solution is.
Great. So I'd like to pull on a little bit of a separate thread that just kind of in that same. So of course it needs to be useful and in workflow, but I'm also wondering, we hear a lot from payers that say, this regulation is out, we have to meet it. But, to me, that's a little bit kind of checking the box. So I'm curious, I'll start with you, Jocelyn, and then Kim, have you comment as well. What are your thoughts kind of going into this next year of, I checked the box, now what?
So I think we're in an interesting point in time as an industry in how we build solutions, right? This shift to standards-based design, I think, is a huge game changer for all of us, because what it's allowed is for people to be ahead of the regulation, so that when we do have an NPRM drop, it's reflecting and looking at sort of progress that's already being made out in the industry by these early advancers, which I think is really powerful, right? In the past, you basically got a rule, something got written to solve for it, or something that got implemented that maybe hadn't been fully road tested. Sort of the way that we're developing standards between NCPDP and HL7 has become more collaborative and more iterative in nature, so that there is this sort of evolving nature of real world use to make sure these things are fully baked. So I think that that's one of the things. I think the other thing, though, is that, when we look at all of the work that's ahead of us, it's really about people mastering their data and understanding how to reuse that data across their organizations. And so I think that we're moving to a world where we'll see market differentiation, we'll see competitive advantage for the payers and the provider organizations that really do understand what it means to master their information and to leverage sort of the industry shift to APIs like the rest of the world already did, right? Being able to make that data available when it's needed by the end user that needs to use it, that can actually impact value or change. It's not just about rolling out technology. It's not just about checking the box for a reg, but it's those that can take the time to be planful about how are these changes going to be used across their organization, and not just to meet that one-time moment in time regulation. I think are going to be the people that are poised for success.
Yeah. Kim, anything to add to that?
Yeah, I agree with Jocelyn and all of that. Imagine that. I agree. I do. I think Jocelyn hits a nerve. We talked about specific, what I would say, processes or applications or points in time to help move the clinical decision support capabilities from a prescriber workflow, but upstream, we're also, we're talking about that transparency side too, right? The data, the evolutions that come out and are used, to Jocelyn's point, to get providers to use it, they have to be usable, right? But the data also has to be real time, right? Real time, transparent, usable data, right? So I think transparency is coming to full circle as a part of this whole evolution to adoption, with the requirements from, the CMS transparency and coverage final rule, the Medicare, hospital outpatient prospective payment rule, and the No Surprises Act. We've not even talked about that, right? Those are catalyst regulatory initiatives to help improve the patient experience, to what Jocelyn said, better consumers, right? To make us more informed consumers. But those who are a part of this ecosystem really need to be thinking about more on how to utilize that through their strategic initiatives. And I think through 2022, we should see continued emergence of new applications in the marketplace that will, derive from this transparency to help facilitate that consumer access, and not only the access, but understanding what it is they're reading. We have a significant health literacy problem in our country as well. So we've got to be able to take that transparent data into those utilities and be able to give the consumer something they can understand. And I think, plans and providers really need to take hold of that from their strategic initiatives and figure out how to utilize that and build brand loyalty, build an ecosystem where consumers are continually coming back to them as a means to understand how to gain access to their needed care, needed services.
Yeah, absolutely. Jocelyn, anything else to comment on transparency?
I have like 5,000 things to respond to what Kim's saying, but I won't derail us too much, because I think that, when we think about, we're at, everybody got ready on the payer side, right, for patient access API in July. They checked the box gracefully. Yeah. Some people leapt across the line. Some people dragged themselves across the line. Some people finished the line and then got to do some homework to get up to speed because they didn't pass the test the first time around, right? Everybody was at a different point in time. But I think that, these are basic building blocks, right, that are going to fuel the way we work for the next 20 or 30 years. And so I think everyone needs to almost take like a collective breath and say, how are we setting ourselves up for success? And how are we moving forward with, if we're at step 3 of a 2,000 step staircase, right? How are we making sure that everything that we're doing is getting incrementally better? And I think if we think about this, one of the other things Kim and I got to do over the last couple of years is do some testimony with NCVH or with a group under NCVHS for the intersection of clinical administrative data as a subgroup under high tech. Gosh, I could probably have used more acronyms within a sentence if I tried. I don't think I could. Seriously. So we got to basically spend some time saying how do we actually sort of bring these two worlds back together? And I think that, if we think about everything that we're doing in this API move, whether it's prior auth, whether it's real-time benefit check, whether it's the patient's cost obligation, for their care, it all ties back to the same thing, which is in order to provide care, you need to inherently understand what someone's insurance plan actually pays for and covers. Mm-hmm. And that the more that we can bring those two worlds together so that there's a relationship between that care, the cost, and the quality of that care, then we're moving in the right direction, right? But that's not going to get fixed overnight. And regardless of what happens from a regulatory perspective, I assume that we're going to see a lot of noise and we're going to see a lot of churning from different parties because, getting into this idea of what cost is and what patient obligation is in care, is fundamentally going to change business models and what data gets shared in the industry in a transparent way today. We can all say, yay, that's great, make it more transparent, but that has real world implications. And so I think that the sort of the business side of that versus solving it from a technology side is going to be the long road to hoe. And I anticipate that many of our colleagues will have a lot of public statements to make as those rules actually start to make their way into NPRMs and out of guidance.
Yeah, great. So let's shift the discussion a little bit to this compliance and enforcement. Jocelyn, you mentioned kind of the payers that passed the line, those that just made it to the line, which I think is a great
I'm not
analogy.
naming any names. I just get to see it.
Yeah, exactly. But that brings up a good point because there have been some changing deadlines. There's been announcements about delaying enforcement of rules that have already gone into effect, and I think honestly that is somewhat of why people are just making it to the line because they're probably figuring, hey, things are going to change. But Kim, let's start with you. Can you break this down a little bit about kind of what this means to stakeholders? Is there anything they need to be worried about? Should they be planning to meet these rules? I'd love your take a little bit on that.
Yeah, I do come from a compliance background, right? I do come from a policy, so I am about compliance. So, although there have been delays and those have been announced, just like, you and Jocelyn have indicated, regarding portions of the No Surprises Act, which we mentioned earlier, which is part of the Consolidated Appropriations Act, and the Transparency and Coverage Final Rule, where group health plans and health insurance issuers and healthcare providers and, around their compliance and policy strategy, right? Those policy teams and those strategists within those organizations should be in deep evaluation and how to comply with those provisions that were delayed, and not only comply, but how to utilize those rules to support more cost-effective use of healthcare services by both patients and the providers that are within their networks, as well as build on what other industries deem as, and I said this earlier, brand loyalty, right? In an effort to keep those patients coming back into those providers' offices and staying with those health plans year over year. We are driving to a value system, a consumer-driven system. Do I think it's going to happen overnight? No. But I do think those who are impacted by these rules really need to be thinking about, how can I get ahead of this, right? Although it's been delayed, I would anticipate, because we are in the midst of this transparency and moving toward value, that the rules are going to continue to come out, and there will be an eventual compliance timeline. So get ahead of that. And lastly, on the areas where the rules and regulations have been issued, such as like the ID care and continuity of care and provider directory, things like that, or balance billing prohibition disclosures, those that are impacted should be implementing those provisions and using good faith, just as indicated by the agencies. You should be moving forward in good faith with a reasonable interpretation of the statute. I just love all of that gray area right there. So, but I do think that these organizations can utilize this and think more broadly about their strategic initiatives and what they want to prove out as organizations, and use these to their benefit versus the detriment.
Yeah, great points. Jocelyn is the program manager for Da Vinci. You probably deal with this every day, right? Any additional comments?
I think it's so I think first off, I think that one of the things that folks that don't live and breathe policy on a regular basis need to understand that really, until a piece of legislation actually has a policy enforcement, some sort of a regulation to tell you how to apply the actual law that was passed, right? We are in this limbo place, and it's caused some very interesting and chaotic conversations out in the industry, where there's a vacuum, right, where we're waiting for reg to appear, or proposed reg to appear, or even guidance about sort of, how big is the bread basket. And I think that's important to recognize that, I think guidance is important. Understanding sort of where the ball is headed, I think, is important for all of the folks that Kim just described that are inside of organizations trying to set a course forward, right? Trying to pick sort of the next 4 steps. And in lieu of there being no or delayed communication, it causes chaos and aberrant behavior, right? People do things that are nonsensical because they have to do something for their all of their chain of stakeholders, right? That they have to communicate with. And I think that that's challenging. I think that incremental progress, I think, is going to be incredibly important for us as we see alignment here. But I also think that, we see when a reg gets put into place for somebody around a government program, right, like Medicare Advantage or CHIPS, that folks adopt that in their commercial lines of business, and that providers adopt those workflows across the board. And I don't want to underestimate the value of that, because, in some ways, it seems really simple to say things like, we need to fix and make sure a patient understands what their obligation is. It's another thing to take all of the Titanics, right, that were built around X12, separate completely from clinical workflows, right, 30 or 40 years ago, and say, how do we start to service the information so that we don't bury providers who, let's be clear, for the last 2 years, we have been operating in a sphere that is not the norm, right, in the middle of COVID, and our provider organizations sort of dealing with wave after wave of, just surges and, changes to the way that they're practicing in their markets and caring for, their sickest patients. So sort of the new innovation stuff takes a backseat to that, right? But to Kim's point, now more than ever, we know we need to unlock this data. We know we need to make the data available and accessible. So I think that this ability to be able to say, reg is coming, let's not panic, let's wait to see what the reg actually says, and to allow industry to derive potential solutions that CMS and ONC can point to. I think we really have changed the way that we work as an industry by allowing industry to be out ahead, right? From a RTBC perspective, from a CAA perspective, from, all of the work that's happening sort of out in the market today. And I think one of the things that's incredibly interesting, sort of just to bring this, back to where we started the conversation, the coordination and the cooperation that's happening between the folks on ONC, the provider side of the house, right, the vendor side of the house, and the payer side of the house, the CMS side of the house, and CMS working with its providers, that take funds from CMS as well, is unprecedented, right? And so I think that, I feel like we're at the way that we are going to get things done. And I think that people being able to be proactive and be ahead and not wait for the absolute final rules to drop, I think is important. To wait for having to have the stick to act, I think is incredibly important, almost so that our partners out there in the industry really are driving to their own destiny, as opposed to waiting around for somebody else to pick that destiny for them.
Yeah, great insights. So I feel like we could keep talking for hours, but I know our team is probably like, all right, so let's work towards wrapping up this podcast. Kim, any particular calls to action that you have for our industry and our listeners?
Yeah, absolutely, Pooja. I would tell everyone, Jocelyn said it better than I did, but I'll say just keep on pressing. If you have a policy team, work with them. Partnering with them to align your organization's policy initiatives with the strategic goals of your organization. Bring your subject matter expertise to the table, shining a light on the really good things that you are accomplishing in your organization in healthcare, but also assisting those regulators, those legislators, and the standards development bodies, those organizations like HL7 and NCPDP, to close the gap on interoperability. I think Jocelyn highlighted it quite well that, those entities who do bring out those regulations that eventually folks will have to comply with or get in compliance with, are really watching and ingrained in a lot of this standards development work and are just looking for an opportunity to name, something that is standard that the industry can get behind and utilize.
Yeah, definitely. All right, Jocelyn, last thoughts and reactions.
I really can have this conversation all day long with the two of you. So I think it's fantastic. I think we're at a point in time, and we've been having sort of, our year-end wrap up and our sort of what's going to happen in 2022 conversations, right, as a consultancy. I think we're at a point in time that we're going to shift away from there being sort of 1 to 3 or 4 people that sort of know all the things about all this interoperability stuff inside of an organization, or the face to the industry of all this work, to really evolving to a place where interoperability is the way that things get done, whether it's internally serving your partners' data inside your organization, or making the walls between you and your partner organizations a little bit more permeable, right? If we go back to sort of our high school science classes. And I think personally, that the organizations that we get to see that are really thinking about this strategically and in a differentiated way, and are empowering and training the workforce that is versant in these topics, are the ones that are really the most agile in performing, and we're getting to see the benefit of these investments they're having to make for rules in other areas of their business, and they're tightening the partnerships, that brand loyalty piece that Kim's talking about, tightening their relationships with their partners in the market because they're figuring out these problems together and really driving the industry. So I think, to me, the challenge, as we think about our listeners and your colleagues, is, how are you guys gearing up your organizations to be ready to not have 5 people know all this stuff, but to really have everyone inside your organization understand some base level of functionality about how you're going to solve your business problems, and technology is going to be an enabler to do that, and how that's going to ready you for, Kim's point, a wave of regs that are coming, whether we like it or not.
Yeah, I love that. I think just earlier we were saying interoperability should be on everyone's agenda in all meetings across the organization. And I think that's a really good point. And, hopefully we'll get there soon. So great. Well, hey, I just want to thank my co-host, Jocelyn Keegan, and thank you to our wonderful guest, Kim Boyd. And thanks to our audience for listening to our this first edition of the Dish on Health IT in 2022. And just a friendly reminder to our listeners, you can listen to us on Apple Podcasts, Spotify, or really whatever platform you use to listen to your podcast, including on Healthcare Now Radio and the podcast channel. And just as a reminder, we do post our videos on our YouTube channel, so feel free to head over there and watch them as well. And as a reminder, Health IT is a dish best served hot. So thank you all for joining us for this first episode, and we look forward to chatting with you all throughout the year.
Is it a challenge to stay on top of interoperability regulations and the flurry of activity with fire accelerators? Email us at interopoutlook@pocp.com to learn more about our new Interoperability Outlook subscription monitoring service.